Hello, welcome to my presentation. Today I will be talking about pediatric TBIs and their effects on pragmatics. So just to give a little bit of information, here's an abstract that I'll present to you. So the purpose of this is to identify if pediatric TBIs, or traumatic brain injuries, have an impact on pragmatic and social development in children and how it is that they may be affected. I did this by utilizing LaSalle University's Connolly Library's databases via its summon function, which then brought me several peer-reviewed articles to review. The search terms that I used were pediatric TBI and pragmatics, and the search requirements also included peer-reviewed and had to be published within the last 5 years. The results that I found is that the presence of pragmatic deficits subsequent to pediatric TBIs are well documented in the literature. However, there is a need for more aspects to be focused on treatment settings. The pragmatic deficits include story retelling, general pragmatic language, difficulty with social contexts, and displaying behavioral problems. Conclusion: more research is needed regarding the application of information pertaining to pediatric TBIs and their effects on pragmatic skills of children. So here's a little bit of an introduction. Per ASHA, approximately 500,000 children up to age 14 are admitted to ERs as a result of TBIs in the United States. Ages 0 to 4 had the highest number of TBI ER visits. This is followed by 15 to 19-year-old individuals who are the second highest demographic. All of these individuals are at risk for these pragmatic deficits, particularly those who are at 0 to 4, as they are still learning and acquiring language and learning about these pragmatics. Common causes. So the number one cause are falls, followed by a struck by or against event, motor vehicle accidents, assault, or an unknown reason / other. Falls are most common, and this is across the lifespan, but is really evident in those who are between the ages of 0 to 4, as they are still young, still learning to walk, and are most at risk. Children who experience a TBI are at great risk for difficulties with pragmatics. In one of the articles that we will be reviewing further later, it states, cognitive communication impairments are characterized by difficulties with listening, speaking, reading, writing, conversing, or interacting socially that have resulted from underlying cognitive impairments in attention, memory, organization and information processing, problem solving, or executive functions. These difficulties with pragmatics can affect academic and social endeavors. The literature is continuing to expand regarding this topic and is becoming well researched. So here's a list of the articles that I'll be reviewing today. So let me go further in depth. This first article, which is Cognitive Communication Impairments in Children with Traumatic Brain Injury, a scoping review, reviewed information in the literature concerning pragmatic impairments in pediatric TBI patients. The objective was to review the literature and find out what was missing in research and to recommend what should be further research in the field. They found that not only is more research needed, particularly for clinical practice, but they also found that there is more to a diagnosis and the severity than the original TBI severity. In other words, pragmatic deficits are not reliant solely on the TBI severity. Other factors contribute to this ability to either conserve or to lose these pragmatic aspects of language. The things that developing skills at the time of injury are most susceptible to impairment, followed by the fact that standard norm reference language assessments are not sensitive in detecting language impairments that are due to cognitive impairments found in TBI, meaning that some of these children will fall through the cracks due to the fact that these language assessments are not sensitive enough for them. This could mean that they pass these tests and then are not receiving the aid that they need from a specialist such as an SLP. In this one, a clinically focused systematic review of social communication in pediatric TBI, it reviewed information in the literature and explains the findings for use by clinicians. The objectives were to analyze recent evidence and also to translate these findings for clinicians. And they found that recognition and finding deficits associated with pediatric TBI are well documented. However, once again, The focus must now turn to clinical application. So in other words, they have proven that these deficits exist alongside pediatric TBI. But now the emphasis must turn to what are we going to do? This third aspect of my literature review is early elementary school outcome in children with a history of traumatic brain injury before age 6 years. This was a 3-year longitudinal study to describe the outcomes in elementary school for children who experienced a TBI before the ages of 6. They found that there were deficits from their peers in many areas, including pragmatic language, as well as story retell, and other important aspects of language. The conclusions that they pulled was that it is important to have a specialist assess the possible deficits that may otherwise be missed. By not having the proper specialist review, they may miss something important, and it is through that we may have those kids slip through the crack, particularly if we are relying on norm standardized tests. In pragmatic skills after childhood traumatic brain injury, parents' perspectives, they actually interacted with the mothers of children who experienced a TBI. They wanted to see what pragmatic deficits that the mothers picked up on within home environments and social contexts. And this information was gathered by giving semi-structured interviews to the mothers as well as some questionnaires. And those mothers found that children have average pragmatic skills at home. However, several in-home and outside the home social contexts emerged in which pragmatic deficits or social behavior problem themes were identified. They found that in-home contexts typically had difficulty with social contexts. Being outside the home typically led to problems with behavior. So what are the clinical implications and the relevance to CSD? So pragmatics does fall into our domain and is integral in social communication. Identifying these pragmatic difficulties early will aid in a child's ability to create and maintain meaningful relationships with peers and adults. And these adults can also include parents, educational professionals, and other relatives. This also puts children who have experienced pediatric TBIs behind peers in academic and social settings. Being unable to understand these aspects of language will make it more difficult for them to make friends and to interact with adults and peers that they might need to speak with in order to continue to progress academically. It is also important to make sure we have a full evaluation and we introduce some long-term follow-ups. It's helpful to have all professionals involved to identify any deficits. There should be a whole slew of team members, including an SLP, PT, OT, etc., etc. Some of the children are not identified as having difficulties because they perform well on these tests. Having all of these professionals in and analyzing these children to see if their deficits are there will increase the opportunity to identify these deficits despite what they might score on a standardized test. Contexts are also very important with these children because in some areas they may be more comfortable than others. They may appear to have average pragmatic skills at home, but not in outside the home environments, such as school. Looking at these contexts will allow us to see where we need to look at. Because also, these pragmatic deficits may result in behavioral problems. Additionally, research on the effects of pediatric TBI is now available. However, there's also research on the how of treatment, which is where we now have to turn to. Further investigation on assessment and treatment must continue to aid in the development of pragmatics in children who experience a traumatic brain injury. Without this further research, we will have less opportunity to help these children. In summary, pediatric TBIs can affect our pragmatic skills in children. Further investigation regarding assessment and treatment is necessary, and the effects of pragmatic deficits include trouble creating and maintaining relationships, difficulty in school, and negative behaviors, particularly in out-of-home contexts. Thank you so much for listening to my presentation today. I hope that you enjoyed it, and here are my references.